Hello and welcome to Healing Tips from the Heart, Intuition with Helpers, Healers, and Guides. I am your host, Dr. Lori Hops, licensed psychologist, writer, and artist. I've explored mind, body, and spirit related to intuition, or your personal guidance system, since early childhood. Meet my guests who have learned from their personal and professional lives to explore vast realms of knowing, synchronicities, and overcoming challenges. Their stories may inspire you with tools to enhance your daily living and relationships. Hello, everyone, and welcome my special guest for today, Dr. Alice Lee. Dr. Alice is a holistic and integrative child, adolescent, and adult psychiatrist practicing in Stamford, Connecticut. She has been working for past decades integrating functional and energy medicine techniques to pioneer new ways to safely support psychiatric medication withdrawal. She is certified as a Reiki master, has written hundreds of articles on holistic topics, and started a podcast called The Holistic Psychiatrist. She is serving on the board of directors for the Association for Comprehensive Energy Psychology, or ACEP, which is how I met her through that organization. And she has taught at that conference that we have a couple of times that I've seen her, I think 3 times, written articles. And her goal has always been to help patients achieve lasting wellness and freedom from their role as patients. And I am so happy to have you with us today, Dr. Alice. It's so good to see you.
Thank you so much for this opportunity to share a conversation with us together.
Yes, yeah. And I've seen you teach in person, worked with you a little bit, here and there. And you really bring so much of your heart and soul and dedication to really groundbreaking answers that have been plaguing humanity forever about that balance between wanting to find interventions that don't harm and giving the person enough room to be able to have their own sovereignty and integrity, to be able to come to a sense of wholeness and self-acceptance. And that, regardless of your topic, those themes, for me at least, come through every time loud and clear. So I haven't actually stated that to you before, and I can see that you're smiling as you hear it. So I just wanted other people to kind of know what I've observed about you, and as we kind of share the magic together today.
Well, thank you. That really is something that I personally feel deep in my heart, and I try to live it in my life in every aspect of my choices and
Yes.
how I interact with my patients. So
Wonderful. So today, is there anything else first of all, that you wanted to add to my description about you, or anything you want the audience to know before we get started?
not in particular. It's just that I think even after decades of working on this issue of helping patients get off their medications, I'm still learning, I'm still growing. And the more I learn about it, the more I feel it's important for other people to hear about it, to leave them with a better understanding of what medications do to people, and how to make better choices, that there are choices out there before we just jump on the mainstream bandwagon and start taking a medication.
Yeah, and I think that that makes you very unique. There's not that many psychiatrists that I've known in my career that have helped people actually find a balance with how much medication, or if they should be taking it at all. because obviously the training, at least in the last 35 to 40 years, has been, or a little bit more, has been around the breakthroughs of medication management, because obviously in the history of mental health, we didn't have that kind of technology before. And we did our best as a mental health field to help people in really dire circumstances when other methods didn't help. There wasn't much that could be done. And we don't need to go into the whole horrors of the history of psychiatry, but it's very grim.
Mhm.
So there was so much hope that medication would be the answer. And it did help a lot of people, but there's so many side effects, and it's such an individual and unique response for each person in their body, in their psyche, in their lifestyle, in what happens as they go through their life, because things change over time. And so sometimes taking people off medicine is the best thing, and yet there's all kinds of traps around that. And so it has to be done very carefully, because it can be quite dangerous. And what I love about the work that you are doing is that you aren't just an expert in medication management and withdrawal in a safe way, but you're also able to introduce energy practices that help ease that transition and maybe even build more strength and resilience. So I don't want to take away too much from your talk, but just to kind of give a framework for what this is about, because you might be the very first person that the audience is meeting that even explores this idea. So I kind of wanted to give like a landscape for it, but the floor is yours.
Thank you. Yeah, I think for many people, they've never heard of a holistic or integrative psychiatrist out there whose main mission has been to focus on helping people naturally heal from mental health issues, and who can bring a different perspective than using a prescription medication. Although I agree with you that prescription medications do have a place, especially in terms of you know, immediate, critical crisis interventions. I
Hmm.
think these medications can be very life-saving. I also think that it's very difficult once you're on these medications to determine when it's okay to come off of it and how to come off of it, because a lot of psychiatrists are not really trained to help people come off medications entirely. They're taught how to switch from one medication to another, and they're very good at that. But they don't have alternative tools to help people get off these medications as a universal approach. So I was taught in medical school and residency that you just do it slowly, but there's no, idea what slowly means. And by the time psychiatrists are even contemplating getting people off medications, their body has become very dependent on it.
Hmm.
So it's helpful for us to understand that. Um, so a holistic psychiatrist, people are wondering, what do holistic psychiatrists do? And I can only speak for myself that my goal is to help people to heal mental illness, both from a medical perspective and also a, biological perspective, but also integrating our understanding of psychology and trauma, and to be able to help heal people from all different perspectives so that a person can truly be well and require less medication over time. And then a holistic psychiatrist will have the kind of tools that they need to be able to tell when to lower a medication, how much to lower, and how to do it safely. So, although I say that, you know, in a really succinct way, it's not a succinct process. Sometimes for people who've been on medications for a long time, it may take a long time to do so. But the more tools a holistic psychiatrist has at their disposal, the more this withdrawal process can be painless and it can actually happen fairly quickly. So that's what a holistic psychiatrist wants for every patient, for them not to be a patient for the rest of their lives. And then what are some of the tools that I've integrated in my journey to help patients. Back in 2002, the first extra toolbox that I ran across serendipitously was functional medicine. So functional medicine is going back to the roots of our biochemistry, understanding how these vitamins and minerals and essential fatty acids and glandular supports work, and trying to support the body so the body can have more tools to help heal from either genetic or toxic or infectious underlying causes. And that has been a very powerful tool. And then in 2003, I ran across a wonderful therapist, Mark Botnick, and he taught me about emotional freedom technique and tapping. But at that time, I was also exploring Reiki, and I was getting many mentors who taught me about energy medicine. And so I was starting to learn that there is a path that can also help people heal biologically that doesn't require a pill. And so I started to learn about that. And as I learned more and more from each of these fields, I would kind of integrate them together. So there's got to be not only content, but process. So what I mean by that is you have the tools like vitamins and minerals and things like that from functional medicine, which I think of as building blocks for health and well-being. And then you have the tools in energy medicine, whether it's, EFT, tapas acupressure technique, ask and receive, or my own technique, empower energy technique. There's many different, or acupuncture for that matter, or Reiki. All of those different energy techniques are tools, but you got to tie them together with a process. So I started learning about energy testing, and I started to tweak it and adjust it in a way that I could use it to help guide the healing process. So for me, I call it criteria-based energy testing. So it has specific criteria, it has scales, and I started working on that back in 2003, creating many scales to measure how a patient is doing functionally. How are they doing with stress? How are they doing with addressing the traumas? And with that, it really helped to educate me about what are the underlying problems that patients come in with. Sometimes it's mostly genetic. Sometimes it's a combination of toxicity and infection. But more recently, I've understood more in depth how the body's embrace of the medications, adjustment to the medications can cause its own uh, barriers to coming off the medications. So for example, if you take a medication for a long time, and if it's a very powerful medication, the body will stop doing its part and allow the medication to kind of take over its portion. And when you come off the medication, it doesn't automatically mean that the body's genetics and enzymes and even the brain anatomy will just spring right back and take over the function. Sometimes it doesn't. And so that's the field where energy medicine can make a huge difference, because it's not something that a few supplements can just intervene and fix. It's the difference between, let's say, if you were trying to support a tree with stakes, and ties, and the stakes go in the ground, and let's pretend that these ties are actually tied to stainless steel like hooks that go into the trunk of the tree. And you put those stainless steel, like screws into the tree, and then put the ties in the ground to strengthen the tree so this tree won't, fall over as it's developing. But over time, as a tree grows stronger and has those stainless steel screws in it, if you remove all of the supports, you end up with holes in the trunk. And you can feed the roots of the tree with nutrients like, supplements, but it doesn't necessarily get rid of those holes in the trunk. So it's a very different level of harm to that tree. Now, if I were trying to use it just from a functional approach, it would be analogous to me taking some fertilizer, rubbing it in the hole in that tree, and expecting the hole to heal. And you're like smiling because you know that probably wouldn't work, right? The roots will absorb the nutrients and it'll try to heal the trunk, but there's still going to be those holes. So with energy medicine, you're using energy. And energy gives information and support at the energy level. So it can heal anything above pure information. And it has the hope of helping the tree to understand, hey, you have holes in your trunk, and let's fix it, so that the tree will focus on those areas and know how to fix it. That's how I've used energy medicine, sometimes to either speed up the medication withdrawal process or heal areas that are higher level at a higher level of organization, so that the two, functional medicine and energy medicine, can work together to make a complete and optimal like delivery system for each patient, because every patient is unique.
Wow. Ah, I love how you described it. I'm right there with you with the tree.
Oh.
As a great analogy for me, at least as a listener. So, to summarize, if I've gotten it right,
Mhm.
you have picked up some really powerful individual tools that you have found in a creative way to collaborate with one another and work towards a system that each in and of itself doesn't answer the full picture. And there is nuance to figuring out for each person how much of this and how much of that, how much supplement, how much instruction on a maybe soul level or energy template level does the organism need, all of that. And you mentioned, is so far, is that, and then I have a question, is that accurate, that
Yes.
summary?
The one thing I forgot to mention is this is a whole new paradigm shift with psychiatry, because it's not really something that I'm in control of. What I mean by that is that it's a 50-50 working relationship between the clinician and the patient.
Yeah.
And therefore, it's not something that's here, take a pill, it's really easy. You don't have to do anything. I'm in charge and I'll tell you what to do. That's not how it is. Every patient that comes to see me is a co-partner in the healing process. And I think it was meant to be that way, because true health in some way needs to be earned through a healing process. And that healing process allows the person to shift not only their mentality, their lifestyle, but also to develop discipline, to develop a sense of their own personal control over their lives. And you can't develop that inner essence of, I did this, if your entire healing process is due to someone else's, work.
And it's not sustainable if it's based on the outside.
Right.
Not everyone is ready for that collaboration and that level of responsibility. It's a lot of work, actually.
Yeah.
And it can be so exhausting and daunting to just be under the veil of mental illness and then to have to work so hard to scramble out of it. It can be exhausting and debilitating. And you can think like, well, is it even going to work? There are no guarantees. So I can see why certain people maybe wouldn't be ready or interested in it. But for those who are, what an adventure.
Yeah.
And it
It
can
is.
be so exciting to see the results.
Yes. And people who do heal have really worked for it. And when they come out of the other end, they own their own healing process. They know that it was not possible just because I asked them to do this or that. They know that they
Yeah.
had to do their part. Yeah. Okay, what was your question?
Yeah, so you kind of skipped over this a little bit quickly to get the big
Mhm.
picture, but I know that there's more to it. So I wanted to highlight this idea of criterion referencing or being able to. So this is what I heard you say, is that people come with a whole bunch of different aspects of their being that might need to be addressed, but it's hard to know which aspects when in what combination. And you mentioned that you created lists of things to be able to help you kind of like create a map for every person. And since I know the buzzwords, I know that that was referring to energy testing. But for those who don't know that or think of it as muscle testing, what's the difference? If you could kind of just give us a snapshot of that, if it's all right, because it's almost like the passageway into this big land that you're talking about that you've created, but you can't really do it so easily without that passageway.
Oh, yeah, ex exactly. Um, I'm glad you mentioned the word terrain because I actually call it checking the physiological terrain.
Oh,
Yeah, checking the physiological terrain of each patient. And it came from this idea very early on in my exposure to EFT when clinicians, the psychologists or therapists who work with people who do EFT, they would test from 0 to 10 to see how well that technique has resolved their issue. So there was kind of at the beginning of EFT a checking along a scale from 0 to 10 about how that technique, the EFT technique that they just did, how much of that problem has been resolved. And I took that idea and I created scales from 0 to 200 or 0 to 1,000 or 0 to 200 with 4 pluses or whatever the issue might be. And I started working on criteria. So it would be like, what does 0 mean? What does 100 mean? What does 200 mean? And along that criteria, if I go along this scale, where would this patient fall with this criteria? So it would be, the criteria would be based on that patient, date of birth, and a specific duration of time that you're checking. And then you're checking on a particular thing that you want to know information about. So what is this scale made out of? It's a scale made out of energy and information and function. It's not really about levels, which is what lab work often does. So a lab will tell you here, this is your hematocrit, this is your, liver enzymes. But there's still one other step that the clinician has to do, which is take the numbers and interpret it in their minds in terms of function. Well, when I designed these scales, I just wanted to know what the functions were. Like, how is this patient digesting their food? How is this patient absorbing their nutrients? What is their vitamin D level according to their need, right? It's not according to a healthy patient's need, but according to their need.
hmm
And when I started creating these scales, I discovered that um, there's a lot of homeostasis in the body, meaning like if you get one number in one area, you might see that number repeated in other places in the body. And and that made sense because the body has this ability to say, okay, I have just this much to give, and I want to give every part of my body an equal amount, with some areas maybe needing a little bit more than others. But there's a kind of a democracy out there. It's not like, oh, I only like the nervous system, so all the nutrients are going to the nervous system, and I'm going to ignore the GI system completely. That doesn't
hmm
happen with the body. And I also discovered that within these scales that I was creating, that was helping me gather information that I couldn't get quick enough or quickly enough from a textbook or a conference. So you can get information, you know, by using, and this is where most people don't understand this, but we all have this innate ability to have a different response to what is true versus what is false. And if you link that innate ability to a small, biochemical, but biomechanical feedback mechanism that says this is false, this is true, we can really play to that innate ability by creating a way in which that information can then fall into an assessment system. So if we were like, um, machines that can actually test what is true and false, then that machine needs to have a way to express the information. And I just gave it an avenue in which to express that information by creating these skills to assess function. And even now that analysis, I call it the complete analysis, is continuing to be refined and expanded. So initially, I started with 2 scales back in 2003. One was digestion, the other was absorption. And I discovered through those 2 scales that when I lowered a patient's SSRI, their digestion absorption went down.
So
And
that would
then,
be the medication.
yeah, when I lowered an antidepressant, an SSRI,
Yes.
serotonin reuptake inhibitor, when I lowered it, their digestion absorption went down remarkably, even though the patient may not have really overt symptoms of digestive issues until much later. And then several years later, I learned from this pamphlet written by Dr. Abram Hoffer that 90 to 95% of our serotonin system is actually found in our GI system,
Okay.
not in our nervous system.
Okay.
So it's very important for me to be able to access information. And at that time, I didn't know about how to use 5-HTP or pyridoxal 5-phosphate to help build serotonin. Um, so I used energy medicine. I used energy medicine techniques and different things like that to help support the GI system during medication withdrawal. So when we access information, sometimes we don't have immediately at our disposal the perfect supplement that can help that patient recover. But we can always resort to energy medicine. Energy medicine can heal at the information level, and biology is made out of information, as quantum physicists know. So it will percolate and ripple out into the physical realm and help support that patient's biology.
Fantastic. And do you find, I mean, that's a great explanation. I have other questions that may not be important, but moving it forward, do
Mhm.
you find that using the energy information techniques when you may not have the latest research yet, may not even be created to answer the problems, do you find that the information energy techniques are as effective as later on when you find out, let's say, that certain supplements are needed? Or is it just individual to each person?
I think it's helped me so many times with what kind of supplements to use for what patients at what time. Of course, it's limited by how curious I am and how willing I am to use the energy testing criteria. The energy testing criteria is it's made out of subtle energy. It's very susceptible to bias.
Uh-huh.
And so what I found is that sometimes it's not completely reliable. So what I mean by that is right after you do energy work, the person's energy might go up, and then after 3 days, it might settle back down. And
Hmm.
if you were to muscle test or energy test that person right after energy work, it might give results that says, this patient can lower their medication by this or that amount. But as a clinician, I have to be aware that the timing of energy is different from the timing of biology. And taking those two aspects of how the body functions, I would be a little bit more conservative at first just to see if indeed that person needs to lower the medication by that extent. Sometimes I'm too conservative, and the person might experience maybe more side effects from the medication because they're not lowered fast enough.
Hmm.
But it's better to be safe than sorry.
Yeah.
And so I've learned to be, careful with lowering the medication, but medications can be lowered a lot faster with the help of energy medicine for sure.
Yeah.
Um,
Yeah. It's so fascinating how this is such a radically different paradigm than many people were raised with.
mhm,
The idea that the invisible, subtle realm has information that can be directly communicated in real time
mhm.
and give us access to so much more than we can get from lab readouts or someone telling a story about what happened, or even our own minds thinking that we know the answers, or even what the questions are. And so it takes an open mind, some amount of faith that, or willingness, I would say, to delve into these realms because the landscape that we're used to is kind of like not there. It's like going down the rabbit hole with Alice in Wonderland. You're in a different world. And yet the ordinary world we're used to still operates. And it's a matter of integrating all of it together and being able to see in multiple ways, kind of like kaleidoscope. Yeah.
Yeah, I was watching a movie on Nova about, quantum physics and string theory and Einstein's theory of relativity and Newtonian physics and everything. And I was fascinated by the fact that, some of the findings in quantum physics really confuse and go against what we know in Newtonian physics, or even based upon what Einstein's theory of relativity would dictate. So there are different ways in which I can put on a different hat, and I can be the energy practitioner, or I can be the functional physician. And I can also be a psychiatrist that helps me to kind of like see that not everything gives the 100% right answer. And I have to integrate these three fields in a way that will keep my patients safe.
Hmm.
You had asked me about whether I find out new information through the energy testing um, that will eventually show up.
Hmm.
One of them, of course, was what I demonstrated, which was that I learned more about the GI system and about the serotonin system helping it than, you know, much earlier than I would when I found it in a textbook.
Hmm.
But one of the things for example, that I learned that's different from orthomolecular psychiatry is that I don't use just a few supplements in huge amounts. That was not how I was guided to recommend supplements to my patients. It's usually actually in small amounts below what the supplement companies recommended for patients. And it would be a little bit of this and a little bit of that, kind of synergistically working together. So that's how I have always delivered the supplements.
Hmm.
I also found out that if I do 3 sessions of really great energy work for patients, that their need for supplements actually go down by about half
Wow.
after 3 sessions. So they save a lot of money if they don't just jump right into taking supplements,
Yeah.
because the energy work can heal so much of the biology of the body that you
Yeah.
don't need as much in terms of nutritional supplementation.
I love it. Thank you so much for these wonderful explanations. And I'm thinking to myself, reflecting on my own past about using homeopathy with energy work. And I'm so, let's say, responsive to suggestion that I found that taking the homeopathic supplements remedies were too strong and would actually cascade me into many multiple healing crises. So it was too much. And so what I was able to do then, working with my homeopath, was to only introduce the idea of the supplement or the remedy. And then within a few moments, my mind, body, spirit system would metabolize it. And we were able to, let's say, in the course of an hour, go through like maybe 40 or 50 different processes
Wow.
and then not do anything for maybe several months
Mhm.
and just sort of live my life. And then gently, gradually integrated with my daily life, things would unfold. And so, I mean, it saved a lot of money for me. And it saved a lot of heartache because the remedies, at least at that point in my life, they were too strong. It was like taking dynamite.
Yeah.
So,
I
um,
do have an opinion about homeopathy. I did use it for a long time with patients, but they did cause a lot of healing crises for my patients. And I think what the whole premise of homeopathy is to introduce a stimulus that tells the body to heal in a certain way.
yeah,
So it's your body's healing response to that stimulus. And that stimulus is generally an information that comes from the source of the problem. So whatever the problem is, it's introducing that as a form of information, and the body's responding to that information. What I like to do, rather than having that cause the person to go into a healing process based upon what they can generate from their own body, is I like using actually interventions that introduce energy that is helpful. So, for example, I don't know too much about Bach flower essences, but that
uh-huh,
would be, the Bach flower essences introduce helpful energies.
yeah,
And also, there's a company called Energy Tools International that create energetic remedies that contains, information that then you can give to the body. And they can be very powerful too, so you have to be careful what you use.
yeah.
But introducing energy, adding energy sometimes is all that a person can actually handle in terms of their healing process. And I would just say even things like logosynthesis, EFT, or EET, which is what I use, if a person doesn't have enough energy and you're giving them instructions to heal this or that at an energy level, it can actually cause healing crisis too.
Yeah.
Yeah. So you have to make sure not only do you ask the person through energetic or homeopathic or whatever it is that you want them to do to heal, you want to make sure that they have the means to heal it, the energy, the nutritional status, the resilience to stress that they need in their bodies to be able to accomplish those tasks, or else the person will, decompensate.
Yeah. It's like asking someone to cook a meal with an empty pantry
Yes.
versus filling the pantry and then seeing what you can create, even if it's something simple. Yeah, thank you
Yeah.
for that. Appreciate it. Well, we're coming to the end of our time together today. Is there anything else that you'd like people to know before we say goodbye for today?
Well, I just think that it's important to understand that before you start a medication, that what will happen in time with that medication is dependency, and it will decrease people's neurotransmitters. So be very careful before you use that as a first-line treatment, that um, that you should try to explore other holistic interventions. Um, or even you could even start the medication, but initiate the holistic intervention to heal underlying causes rather than waiting, 5, 10, 15 years or even 20 years before you finally decide, well, it's time to come off the medication, because that just makes it a lot harder.
Very wise advice. Thank you. And thank you for creating a whole new paradigm and the future of medicine in the here and now, because my hunch is that the things that we're talking about today that might sound radical or unfamiliar to many are going to become the standard of treatment, standard of care in the future. So we'll remember you well, being the
I hope.
pioneer that you are. And thank you so much.
Thank you so much, Lori, for this opportunity.
Okay, bye-bye, everyone.
Bye-bye.
Thank you for joining us for today's podcast. If you want to learn more, you can visit my website for podcast and resources at hopshealingtips.com. You can also like, share, and subscribe to this channel. This podcast is for information and entertainment purposes only and is not providing healthcare advice. Please seek guidance from your professional healthcare team should you need assistance.